a task we all take for granted until the rug gets pulled out from underneath us because of long COVID or because of a head injury. And then talk about a stressful situation. I mean, it doesn't get more stressful than that. That's literally life or death.
It is literally life or death. If you get it wrong, it's really serious. So let's just start out with the basics and talk about, what is brain inflammation and what you see when you work with people who have concussions and inflammation, and what is that connection with the eyes? What are we seeing?
Yeah. So I think everyone needs to really look at our ability to see, our eyesight,
Hmm.
and vision, which is how our brain is using the information that our eye sends it. We need to look at these two as separate entities. So, as a functional eye doctor, I look at eyesight and vision as different things. Eyesight is a symptom. It's seeing letters on a letter chart, a street sign, what the teacher writes on the board in the classroom. That's what glasses are for. Vision is so much more complex. Vision is how our eyes move together and then converge and track and focus and how we process information, how we make sense of the world around us and then direct the appropriate action. So, really, every vision problem is a brain problem manifesting through the eyes.
Mhm.
Yet, as you know all too well, the medical system we're in, where it's reactive and we're intervening when there's disease and we're treating the symptom, but ignoring the problem, that's really where this work becomes so powerful because something as simple as like your glasses prescription increasing every year, that's not normal.
Wow,
But
really?
that's not, as for an adult, that's not normal, but that's so common because we're adapting to the lens we're in. We're needing something stronger to maintain that same clarity. We go down this vicious cycle. But the
Right.
reason I say all this is, vision's represented in every lobe of our brain. And there are more areas of our brain dedicated to processing vision than all of the other senses combined. So you can't have neuroinflammation, you can't have a head injury, you can't have a concussion without vision being involved. It's just a matter of at what level. And when you start to kind of see the profiles that emerge, there's specific symptoms and challenges that are to a T related to the brain not using the eyes the way in which it's wired, and then life becoming so challenging.
Wow. Yeah, that's amazing. And just to say here that, in our conversations, we both talked about how people often think about brain inflammation as just being from a TBI or from a concussion, from having
Right,
traumatic injury
right.
impact to it. Yet we know that inflammation can come from so many other factors, including viral infections or toxins, emotional stress, all those things. And people who have been struggling with myalgic encephalitis, chronic fatigue, that is brain inflammation, as is long COVID, as is dementia. So all the things we're talking about here are all brain inflammation. And it can be a series of insults over a lifetime that can add up to quite a bit of neuroinflammation, correct?
Correct. And we have dozens of patients in treatment with us right now that have all the symptoms and behaviors consistent with a head injury,
Hmm.
but without a head injury.
We never had
And
one.
when, right? And so it's what's causing this neuroinflammation. And
Yeah.
I mean, the long COVID population that you are a world renowned expert in helping, you know, it's a very similar profile. It's the brain fog, it's the visual fatigue, it's the sensory overload in crowded, busy environments like the mall or grocery store where your brain can't filter and process all that input. And then the fluorescent lights and the patterns on shirts just become so overwhelming that it's like you want to retreat and pull back and not, and it's so hard to handle those situations. It's these maladaptations that are being put into place, these roadblocks that our brain almost taps into as protective mechanisms because it's unable the brain's unable to use the inside and outside muscles of the eyes in synergy, or the brain's unable to process what's in front of us and around us at the same time. And we get into this fight or flight response, which from a visual perspective means our pupils widen and we get this tunnel vision effect. And then all of a sudden, like World War III could be going on around us, but we're so pulled off, like we're looking in tunnel vision that we just need to retreat and get away from all the stimulus from our environment that we're having a hard time filtering.
Yeah, it's so interesting to hear you talk about that because when we talk about limbic dysfunction or stress responses from somatic therapy, it's
Mm,
talking about that exact same thing, right? It's like that the overstimulation, that limbic brain feeling like, we just have to get you to safety. And so I'm
yeah.
going to amplify this experience of fatigue or this experience of pain, or I'm going to amplify these neurotransmitters, your interleukin 1 and interleukin 6 to make you feel depressed and anxious so that you hide, so that you stay in your cave because all the limbic brain can tell is it's not safe out there. I love you. I want to protect you. Go down here. I'm giving you the best information I can, which is to go hide. And that's a maladaptive system. And I
Yeah.
think what's so fascinating is how those eyes, you talk about the eyes and the nerves. I didn't realize that I didn't realize they had sensors in more places in the brain than any other sense. That's pretty incredible
I mean,
statement.
you bring up like the cave. I mean, our ancestors were literally in caves, and the visual
Right.
system was there to scan the horizon for the saber-tooth tiger coming at us
Right.
and to prepare ourselves for danger or to find dinner. But
Yeah.
now we're making these same crazy eye movements in so many other aspects of life, but we haven't adapted yet from a vision standpoint to the world that we're living in.
Interesting. Right. Of course
And
not.
so because of that, like it makes it
Right.
so much more challenging. But you just brought up something I would love to hear you talk a little more about if you don't
Sure.
mind. I had a patient here this past week for an intensive boot camp, and we see people for 12 sessions in 5 days, and it's this heavy, heavy lift, but we can get really great results in a short amount of time. This person, when on during the first evaluation, was literally in the exam chair, closing off, holding his stomach. I could see him tensing up and like gripping the armrests as I'm looking at how well he's jumping his eyes from near to far and how well he can converge his eyes and maintain a single clear image.
Yeah.
And I called him out on it and I said, do you see how tense your body is? You see how you're reacting?
Hmm.
And he could localize this sensation in his stomach
Hmm.
that was this tightness and this kind of somatic discomfort that literally came out a dozen times during the week
Hmm.
during periods where his autonomic nervous system was just being pushed over the limit. And
Hmm.
it was so cool because he was so self-aware to pick all that up. But, imagine those who have no idea that that's not normal and that's just their new normal. I mean, that's all aspects of life.
Right, exactly. And I think a lot of people who have chronic illness have had some kind of pattern of trauma, whether it's physical trauma or emotional trauma or something in the past, and have had coping mechanisms. And his body clenching was part of his body trying to cope with whatever insult's going to, like, oh no, here it comes. Here comes the thing. And a lot of people aren't aware of those patterns until you start really addressing them. As you began to work on the eyes, did that begin to release, or was it through his awareness of it that began to release? What did you notice through the week?
So he had a lot of what I call sensory integration dysfunction, meaning his brain wasn't uh, interpreting and understanding input from all of his senses at the same time. And of course, vision, our dominant learning sense, should be what's guiding and leading.
Yeah.
But whenever we, did vestibular system work
Uh-huh.
or incorporated movement or
Yeah.
incorporated cognition, the more dynamic it was, the more that kind of primitive reflex dissolved and dissipated, and the more he could almost access vision and kind of open things up. Yet if he was in his head more than in his body, it shifted completely.
That's really interesting.
So, we see a lot of about 50-50 adults and kids, but most kids have no self-awareness to be able to know what any of that means, right? And then, the kids who are getting nauseous or motion sick or dizzy when they're reading or on screens, like it's a similar displaced sensation. And those are really the solutions in terms of how they're trying to resolve the
Mhm.
chaos that's happening.
Yeah, and I think a lot of the kids who have any kind of neurodivergent, which is most of them, I mean, I think it's the normal brain that's actually the anomaly, not the neurodivergent one. But if you have these kids who are neurodivergent in any way, they've been interpreting the world their whole life. in this different way and have felt
Yeah.
and so they've literally, like, this kid probably literally felt attacked if he had sensory integration disorder, literally felt attacked when somebody would rush into the room or
Yeah.
something move, and his nervous system had no choice but to go into that fight or flight, but he's doing he's kind of doing a freeze thing, right, if he's clenching
Yeah.
down.
Yeah. Our eyes are our windows to our soul, to our mind, to so many different things. They're extensions of our brain.
Yeah.
But I think looking at eyes in terms of even just how we're controlling our attention,
Mm,
this was, if we can't control eye movements, we can't control our attention. And our ability for our mind to stay focused is deeply ingrained in our ability for our eyes to stay focused.
right.
When somebody's got really poor eye movement control,
Hmm.
and for a sedentary desk work type activity, they're ants in their pants or they can't self-regulate. It can make it seem like there's other things going on, or there's ADD or ADHD or other things, when in fact it's really dysregulation because stress from the environment is presenting too much for us to handle.
So you're saying that some of the adults and children that are diagnosed with ADHD, it may not be like ADHD so much as that it is an eye and brain dysfunction or lack of coordination between the
I,
two?
I would I would say it is an incomplete diagnosis to label ADD or ADHD without ruling out functional vision problems first that cause the exact same symptoms and behaviors and are treatable.
Okay, so that's a point for all of us practitioners that I really just want to, like, for us to just kind of tag there, because I'm going to ask you some more questions about that in a few minutes. But I think that's so crucial. And again, this is why I wanted you to come on here, because I think that those that are trained in the neurological optometry that you are, it's a tool, it's a referral that we need to be doing way more, like way more, because it's one of those ways that we can help people so much more efficiently. And I hadn't thought about it for all of my ADHD people, but now I am.
Mm.
So they're also going to get the referral. So thank you.
Love it. Well, I mean, the child who prefer or anyone who prefers to listen to books with their ears rather than reading with their eyes.
Yeah. Yeah.
That's a sign that vision is probably interfering, or somebody who's using reading as a sleeping pill to help them fall asleep at night because it's so fatiguing,
Yeah.
or somebody who's skipping words or losing their place, or the words are going into and out of focus and blurry or double. I mean, it's hard to attend when there's so much chaos visually.
Right.
And it's not like there's a blood test that says, yes, you have ADHD. I
Right.
mean, it's based off of symptoms, it's based off of behaviors, and more
Right.
than two-thirds of the symptoms in the classification system for those labels are also the same symptoms for functional vision problems like binocular vision dysfunction or convergence insufficiency. And so, I think we haven't really talked about this, and I know you don't want to bring this probably conversation to this point, but I mean, screens are ruining all of our eyes, and even what we're doing right now,
I know.
it's presenting new strain and stress that
Have these on.
allows these problems to emerge more readily.
Yeah, yeah, absolutely. Well, I think it is fine for us to talk about that. But first, I want to talk about what are we've talked some about the signs and symptoms that people may experience for brain inflammation, eye vision problems. But let's just be sure that those are, for the patient walking into the clinician, what should the clinician be listening for? And what should the
Mhm.
patient who's, that expert patient that's going in to talk to their doctor and wants to be seen if they should get a referral for this kind of a workup? What are some of
Yeah.
the signs and symptoms that would, like, what are the top, 3 to 5 things they're like, oh, that's a sign you should get it
Yeah.
done.
So specifically for neuroinflammation, I think the biggest signs would be sensitivity to motion. So whether you're a passenger in a car or in the backseat of the car, especially if you're on your phone or tablet, and that's causing this car sicky feeling, but it's better when you're driving, that's a
Mhm.
clear sign.
Mhm.
Um, Dysfunction or challenge with reading. So it's typically words going into and out of focus, dizziness, nausea, blurred vision, and reduced comprehension. If making those very intricate, careful eye movements across a page are taxing the system and eliciting symptoms, that's common, that's not normal. So I would say that's probably number two.
Mhm.
And then I think number three is really the brain fog, but I know you go really thoroughly into brain fog with your patients. There's lots of types of brain fog, but
Mhm.
there's also visual fog that comes with brain fog. And there's brain fog that comes and goes the more sustained near concentration tasks that are involved versus, if you're on a walk and you're getting brain fog. And so that autonomic dysfunction, that sign of just the world not being open and not being aware of the space and clarity that exists, that's the brain working on overdrive and also using the visual system in a very different way than it's wired.
Mhm. Yeah, I know some patients talk about feeling like they're kind of almost in a tunnel, like they can only handle so much, and it's kind of like they
Yeah.
walk around with pressure in their head and it's like they're in a tunnel. That feels like one
Yeah.
of those things that would be a sign or symptom. And I know for me, my son made this comment to me. He was what, 17? Mom, you drive like a preschool te or you're driving like a preschool teacher. And when he's a teenager, I mean, that wasn't exactly a compliment. And I realized he was right. And this was when my brain was inflamed post-COVID.
Yeah.
And I was always a confident driver. My dad was an excellent teacher. I like driving. And but what he noticed was that what I began to realize is I'm merging onto freeways, and all of a sudden I'm
Mm.
looking 4 times. Like I'm like scared. I'm doing surface roads instead of freeways if I'm driving at night because I'm tired and I don't want to. I'm driving a little bit slower. And there was just a nervousness that I had around me. And I found it stressful to drive. It was just like it
Yeah.
was a lot of stimulation. And that was such a huge like aha. Like of course the teenager picks it up as you're just kind of being freaky and weird and behaving differently. Like you're
Well,
scared.
that's their job, is to call you out, right?
Totally. I mean,
Now,
you're to push your buttons so you can learn and grow, right?
I would say that is diagnostic for not trusting what you're seeing and a
Yeah.
visual processing or visual perceptual problem.
Yeah.
And
Yeah.
that time space continuum that we need to be able to process and then react to, you know, when we're talking about neuroinflammation, our eyes don't work well together as a team,
Yeah.
which impacts our depth perception, our ability to see in three-dimensional space.
Mhm.
And driving, it's not just a matter of knowing where things are, it's being able to anticipate where they will be as
Right.
they're changing direction, as you're changing direction, and being able to plan ahead,
Right. Yeah.
right? And merging onto a freeway as your speed is increasing and other cars and the gaps in space you have to get into, that
Mhm.
is a task we all take for granted until the rug gets pulled out from underneath us because of long COVID or because of a head injury. And then talk about a stressful situation. I mean, it doesn't get more stressful than that. That's literally life or death.
It is literally life or death. If you get it wrong, it's really serious. And you know that. I mean, we shouldn't be driving 60 miles an hour in little metal boxes
Yeah.
anyway.
And then even scary when you look across to the car next to you and you see them on their phone while they're driving on the
Exactly
highway.
right.
It's like,
Right. Yeah, exactly.